Stable with Access in the Justice Transitions project. And because of that project, the idea of bringing healthcare to probationers kind of emerged. And part of that was the cost of healthcare in prisons and jails. And also because we knew that our population was really experiencing a lot of social determinants of health that were, they had disparity then really with being able to get health coverage and health care. So because of that, it started to change. And then this idea for TIP was to bring health care to probationers and parole, community corrections. And here we are today.
It's a pretty complicated story. I mean, we had small teams, groups of people working with every piece of the development of this. We had a project manager who was helping guide our, guide the tasks that we had in front of us. We had people involved from our contracting side of the organization. We had people involved with licensure, and really it was a lot of discovery about how do we do this because it hadn't been done.
I knew that we had committed leadership as well as Terros having committed leadership, and we came together and started meeting weekly. I believe it was about a year in advance of even seeing the first client. We really started, and we used the framework of the milestones and core components to really drive the meetings and what we accomplished. From there, we had to work through licensing, MOUs, maybe modifying a few processes or practices from each agency.
So we did use many of the milestones to make sure our staff were trained appropriately on such things like motivational interviewing and how to develop and a treatment plan for our folks using all of those different determinants of health that I spoke about. As I say, we meet weekly with staff and we talk about the challenges related to both providing the care and also engaging the patients. And I think one of the feedback, some of the feedback I get from the staff is that we need to be continually working on the engagement with the patients and the probation staff.
Adult probation, we have 1,200 employees, we're large. Just communicating with our staff is a challenge. And I know Terros is close to our size, if not our size. So the same thing in both organizations. How do we communicate this immense project that we're undertaking, all the way across the organization, all the way down? I mean, the people at the top get it, understand it, but getting it down to all the line staff that it touches, and we need them to really pull this off for us.
It was discussed early on from the probation office side of things that trust would be probably an issue that this population would have with us in this role. We have been in providing behavioral health services forever for this population, but this approach, coordinating care between primary care, behavioral health, and probation is new. And it's new to the probationers. And the lack of trust, what it does, I believe, if I could say it this way, is it kind of puts all of us into the same bucket of we're all just part of the system. And let's face it, that particular population really wants out of the system. And so, we have to recognize that and move slowly, but continue with our message about how important this is, and along with us in the probation department kind of, emphasizing that continually, we have seen some success. We have a gentleman that was showing up here to see his probation officer and been here several times, and we kept promoting, one of our nurses kept promoting, why don't you step in, and what we can do is some of our screening tools with you, and we can kind of determine some need that we might be able to help you with, and the person kept declining. And not too awful long ago, that person decided, and probably through just watching us and our behaviors, which were consistent, and same with his probation officers, that we weren't out to get anybody, we're just out to help. They finally said okay, and they started working on some screenings and discovered there was some real need there, and we were able to help that gentleman.
think the more important lessons learned from this process has been the collaboration, the alignment between the two agencies. You know, this addiction illness is really difficult to treat. So the more the better. So when there is alignment between the two companies, between the justice and healthcare company, good things happen. And I think having the incentive, the patient having the incentive or the push, so to speak, from the law can bring better outcomes.
So the Target Investment Program has given us the opportunity to look at the whole person in a more focused way. We have served the population, but in a more siloed way. And integration isn't about silos, it's about whole health. And so what we have really looked at now, and we've seen time and time again, is that we look at a patient, and the ones that we've staffed today, the patient got assistance with housing, got assistance with transportation, and those social determinants of health with our community health worker. They just saw then our primary care and had chronic health needs addressed. And they're also being addressed in the behavioral health side of and we have an integrated medical record, which makes it really easy for us to ensure that everybody is looking at the patient in the same way and has all of the information they need to do so.